But emesis is going to be that first line for most of these cases, and as we said, time dependent depending on the toxin, but the VPIS again have got more information regarding specific toxins if it's not something you're familiar with. As we said, delayed induction of emesis is only going to be recommended really if we know that it's something that stays in the stomach for a long time. But that being said, chocolate and grapes probably are right up there with two of the more common ones we get, and xylitol as well. So those patients we could consider actually, you know, it ate it this morning, it's now this afternoon, fine, we'll give it a go at making them vomit. And I think all of us probably are familiar with Emidog. So this is the licensed drug now that we've got, option in the UK. Really nice and easy. So yeah, 1 vial per 10 kilos. So makes our maths really nice and easy. But we can give it IM or IV. Some people, maybe you've got tablets. Some people used to have apomorphine tablets in the older days. No? Fine. So you could put a tablet or the quantity of tablet per body weight in the conjunctival sac. So literally just poke it in. And then they would absorb it from the eye. It would then make them sick. So as they started to be sick, you could then flush the remainder of the tablet out and they don't get any more dose of apomorphine. So that was quite a nice way of doing it because they didn't get that hangover effect of I'm still heaving my guts up, but my stomach's empty. So yeah, works really, really quickly, and side effects obviously just being that it can lead to sedation or bradycardia or that protracted vomiting. So this is our go-to option for dogs. Cats, as we said, always different. Cats don't have the same dopamine receptors as dogs, so therefore apomorphine doesn't work as well in them. And so really we've got 3 options. So either something like one of the alpha-2, so xylazine, dexmedetomidine or medetomidine, but at low doses. So we're not talking about a sedation dose. So just low doses generally tend to work quite well. And again, obviously similar side effects, but the positive side to these drugs is obviously if we do see those side effects, then we can just reverse them. So we can just give our atipamezole and prevent that sedation effect. Generally, I think they work okay. Other emetics that you might have heard of, you might read about. So again, some of these are kind of more based in the States, but hydrogen peroxide is something people have talked about using as an oral form. But the side effects to this are that they can end up with really awful hemorrhagic gastritis and really awful hemorrhagic vomiting. So again, not really something we're going to want to reach for, and it's currently not really recommended anymore. There's syrup of ipecac, that leads to gastric irritation. And stimulates the chemoreceptor trigger zone in the brain, so the bit which it results in the patients feeling incredibly nauseous. Again, very, very difficult to get into patients because it tastes incredibly bitter, and it only is about 50% effective in cases. So when we come back to think about owners doing this at home, you know, we've already said it's probably not going to be that effective, and then this syrup of ipecac is only effective in 50%, so you're really unlikely to get a good effect with it. And then sodium carbonate would be our sort of sodium, you know, baking, washing soda crystal type things. Again, caustic, makes the patients really, really nauseous, and they can end up, if it's not dosed properly, with a salt toxicity. So really we want to avoid that. Just have the pet down, Emidog, apomorphine, done, get it sorted. If it's a cat, obviously an alpha-2, and then get them decontaminated.